Our next guest is going to speak to us about emerging findings in concussion, separating fact from fiction. It's Dr. Anthony Kontos, who's the Research Director of the UPMC Sports Medicine Concussion Program. Thanks.
Oh, it's on the floor. Okay, outstanding. Mickey's a little taller than me. So I'm Greek, not Irish, so I don't have that lineage to pull up here. But hopefully today, we'll look at some of what we know about the injury and some of the things we think we know. And then I'm hoping most importantly to present some emerging data that shows some things that we're learning. And I think that's what this is all about, is all of us learning. And we hope when we're out in the hall and heading to the restrooms and what have you, that we have these conversations. Because last night we started some great conversations, and we want to keep those going as we move forward. Because again, this is an evolving topic. I can't tell you, and you'll see on some of the slides, the amount of information we've learned in very brief periods of time. To give you a conceptual idea of the increase, if you look at the publications that will occur in this decade for concussion, it represents a 400% to 500% increase over the previous decade. So we have a massive, explosion of research in this area. A couple things real quick. A lot of the research I'll be presenting are supported by the groups up here, from the Department of Defense to the National Institutes of Health, the NFL, General Electric, and also the NCAA in a partnership with the Department of Defense. We're doing a study of 30,000 student athletes, college age, over a 3-year period, and that study in and of itself should really shoot the field forward as well. So I'll be talking about a lot of those data today. My primary goals, first is to give you, Mickey gave you a great clinic approach. I'm coming from more of a research to inform what we do in the clinic. So I'll go over some of the bigger picture stats and what we know about the injury. And then the two big pieces I want to get across is really the role of removing players from play. It's a simple decision. I mean, it's not easy to necessarily identify the injury all the time, especially when you have high-level athletes like the one you heard about who say, I'm fine, when really they're not. But once we know that, getting them out is so important, and I'll show you the evidence for that, because there really hasn't been any evidence until the study I'm going to talk to you about today, which was published in Pediatrics recently. And then finally, I'll look at rest and its role with regard to recovery and in comparison to a more active approach. And I think that's where we're moving. Rest isn't bad per se, but rest when it's extended, rest when it's not necessarily the best course of action, and particularly when it's a little bit more involved. My 14-year-old does not need to not use his cell phone because that's the death of him. And so we have to think in terms of the context of what rest is, both physically and cognitively. So first, we'll go over some of the sort of big picture stuff with concussion. And I like to do numbers here. And how many people live in Ireland? It's about 4 million. Is that correct? That's how many concussions we have in the United States. Now, I don't have any data for Ireland at this level, this kind of big picture, but I thought that was interesting. I was thinking that's the entire population of Ireland. And these are just sport-related concussions. These are not concussions that occur from other causes. And when we look at some of those numbers further, it's a big issue. More than half of them, or right around half of them, are affecting adolescents. And they're at big risk for this because of development in their brain as well. Another number that's staggering is the emergency department. So we have any emergency department physicians here today? Just a couple. This is a big issue, is just figuring out what to do. These kids come into the ED, and there's 250,000 of those in the U.S., but we know the vast majority don't show up there. They only show up there when they're overt and obvious and have real problems, and mom's like, holy crap, we have to get you to the ED. There's something going on here. When we look at adolescents, each year, about 10% of them are going to have a concussion in sport in the U.S. And this is what parents see, and they basically look around at 9 other parents, and they say, which one of us is it going to be? And that's tough when you want kids to be active, as we heard earlier. It's very important with obesity and general health and cognitive health. So it's tough when those stats come up to kind of say, hey, it's okay, and we can treat concussion, and it's okay to get back out there. And then there's always economics. The indirect and direct impact of these sport-related concussions in the U.S., $17 billion. Healthcare, lost days of work, whether it's classroom loss, all kinds of different things. And the information doesn't seem to be getting better. Oh, it's a 71% increase in diagnosis. But I challenge that is really we're 71% better at identifying this injury. And that's really what it's about. In this last 5 years, we've done a great job of identifying concussion. And if you look up here, you'll notice that it's plateaued after that initial sort of explosion. And that plateau to me suggests that that's probably what the rate will be moving forward. So right around that 15%. And these are adolescents up here. Down here we have really young kids, pretty static. And down here they kind of lumped this 20 to 64, which is not the greatest lumping, and we'll look at that a little more closely in the next slide. Or actually 2 slides rather from now. So 71% increase in diagnosis. That's the context for the next stat, which is really bad. 60% on most of these injuries are not seeing any care. So you as clinicians, us in the US, even though we're doing a really good job of getting treatments and things moving forward, we're not getting people in the door. So that means 2.2 million of those concussions each year, absolutely zero care. They're not getting any kind of assessment outside of an initial, you have a concussion. And that's kind of scary, especially when you heard what Mickey just said, or Michael, as it is here in Ireland. What you heard him just say about what we can do to get kids better. And these kids are just sitting at home, and they're kind of on their own, and that's problematic. And when you think down the road, the long-term effects, at least the more immediate ones, 600,000 of them having post-concussion symptoms or syndrome, as it's called, and that's where they're lasting, 2 months, 3 months, maybe up to a year with these symptoms. And we know that these kids in adolescence, this is the risk. This is where we see the explosion, is in this early and late adolescent period, and then we see a drop-off thereafter. The biggest period is really that 15 to 17 age group. That's where we see the highest risk for concussion. But there's a big issue with gender. And Mickey alluded to many roles or factors that may play a role. Migraine, somatization, being more honest in reporting symptoms. I know I minimized my symptoms as a soccer player when I had a concussion. So that this is just common, a little bit more so for males than females. Interestingly, though, if you look at the first part, it looks like males have more concussions. But when we look within sports, so if we compare female and male soccer players, the women are actually 2 times more likely in the same sports to have injury. Their rates are 2 times what they are for males. So even though they have fewer overall, if you take across all sports, because they typically aren't playing rugby, they typically aren't playing American football, what we see is when you compare within those really similar sports, it's the girls that are at greater risk for this injury. So I mentioned this earlier. This was just in the last 5 years. We've seen a 150% increase. So if we extrapolate further, it's going to be much more substantial as that continues to grow. So the good news is we're learning a lot about the injury. The bad news is, and so this is the fiction, the vast majority of the information that parents, athletes, coaches, and others get comes from the media. And if you look at this comparison, you heard earlier about chronic traumatic encephalopathy, or CTE, which we're just starting to learn what it is, concussion's role in that, and everything. There were just under 70 peer-reviewed articles in the last decade or 15 years. At that same time, there were nearly 300 New York Times articles about the same thing. So what do you think is going to carry more weight? A New York Times front page, or my article buried, on page 683 of volume 23, number 3? You get the idea, right? So we're fighting a tough battle, and this is the reality, and parents are definitely getting this information and not this information. So with that in mind, these parents, we found out, have some misperceptions about the injury. Nearly a quarter think a concussion will change their kid's life or their lives forever, meaning it's permanent, so to speak. And if you go further, 72% believe the damage to the brain isn't treatable, that it's permanent. And this is leading to the biggest and scariest part. I'm a huge sport fan. I play basketball. You wouldn't know that from me standing up here and adjusting the mic down, but I did. I also ran track, soccer, and other sports, and I love sports. I don't want kids not to play sports. But 1 in 4 parents are saying no because they're afraid of concussion. And that's the only reason that they're saying that. I mean, there are other injuries too, but it's concussion that's the boogeyman here, unfortunately. Oh, let's go back here. Sorry about that. So I'm going to focus now on 2 studies. The first one is going to look at what we're learning about being removed from play and its importance to minimizing recovery time. And you might think, well, Dr. Kontos, that's a no-brainer. We know that. We know that if you come out and you don't continue to play that you're okay. But amazingly, there have been no published studies to show that. We've just kind of assumed that that's the case. So the current culture when kids have this injury is, hiding it, minimizing it, maybe even ignoring it. Like I'll get better, I'll shake it off, much as you did a few years back and much as I did when I played. If you weren't knocked out, you didn't have a concussion, that's only 10% of concussions. That's what it was back in the day. And now we know that's so different. Unfortunately, even though there's been a change in culture about we need to report the injury, the Steelers are leading this, Mr. Rooney and others, we have no data to support this assertion that it's actually better to miss one game and sit out right now to get out. There were no data that said, hey, look, this is how long it will be for you to recover if you don't sit out. And you know what resonates with coaches and players when you say, hey, here's how long you're going to be worse off if you continue to play, not just risk catastrophic injury, which is very rare, but rather you're going to have this worse recovery down the road. You're going to be out of your sport longer. And that really flies in the face of the sort of pain sport ethic, which is suck it up, keep playing. You know, rugby, definitely Gaelic football, I imagine, is similar to soccer and other sports where you just tough it out and you keep playing. And I'm learning more about hurling, which is crazy what goes on out there. And we now have our hurleys, and Mick and I were dueling last night. You know, it's like a weapon, and you're hitting these balls super, super fast. And you know, it's just amazing the amount of potential for concussion you have in a sport like that. But again, we tough it out, we keep playing. So this increased awareness has not translated into behavior change. What's really happened is we still see about 40% of these injuries not being reported, at least in the US. But we think things must have changed since these data in 2004, right? Well, a study just a couple years ago showed that for every one concussion that occurs and is diagnosed medically, there are 27 concussions that are either unreported or undiagnosed. And that was predominantly in the sports of football and ice hockey, but gives you a little bit of context. So, and this is kind of a humorous slide here where it says, boy, back in my day, we didn't get concussions. And you know, this is the thing we often are fighting, is this mentality of back when I was playing, you know, we just kept playing. So what happens if you do continue to play? Well, we did a study of about 70 athletes. I won't go over this in depth, but we looked at groups that continued to play or groups that were removed or removed themselves because they thought they had a concussion. And these all were later diagnosed as concussions. They were about the same numbers of sports of different types, so we didn't have all football in one group, all, you know, basketball in another, so they were pretty comparable. And then we looked at them using impact, the VOMs, and other measures, and we also looked at their recovery time. And we wanted to see how long does it take them to recover when they continue to play. And the first thing we learned is they're more impaired. So if they continue to play, their cognitive impairment is worse. Their memory drops more significantly, and it stays dropped for a longer period of time. And we saw a similar thing, so reaction time, it's, you know, slower is higher, so more, so it looks like it's the opposite effect, but actually this is slower. And so what we see here is that reaction time is slower. And you think about athletes, reaction time's probably pretty important. So if they continue to play, their reaction time suffers. That's not good going back into sport. And they actually even report more symptoms. So they're at least being honest, I guess, here compared to some of our athletes. And they're reporting more symptoms. But maybe the biggest kicker is this, and this is the one we used in that meeting Mickey talked about with youth football coaches. We said, hey, if your kids continue to play, they will take 44 days on average to recover. If they do not, they will take just under 22. Every coach in the room went, wow, over a month compared to 20 days. That resonates, that makes sense. So what that really means is almost 9 times greater likelihood of having this prolonged recovery if you continue to play versus if you get your butt off of the field. And it's tough to do that, but that's the message here. You got to get out. So the sprained brain analogy is what I like to think about here. You know, you run on a sprained ankle, it keeps getting worse. Same thing happens with your brain. That, again, resonates with kids. They kind of get that. It's better to get out now, maybe have a couple weeks off, than to keep going, risk catastrophic injury, though rare, and more importantly, then take 44 days to recover. Okay, so you heard a lot so far in my talk about, you know, what happens when you remove kids. You heard a little bit about the big picture. Mickey talked a lot about treatment, and I'm going to reinforce that with the notion that we need to get kids active, and that activity isn't just aerobic. It should be dynamic with head movements. It should be vestibular therapy and exertion protocol. So it's not just as simple as get them on a treadmill. With that in the sort of overarching context here, there are a lot of misperceptions about treatment. This is what those same parents thought. Well, we rest 50%. Most of the time, we're going to get them hydrated, and we're probably going to do some OTCs, such as, you know, Tylenol or what have you. And that's really all we can do. That's what parents, this is it. This is all they perceived as treatments. And unfortunately, the consensus statements, even the more progressive ones like in the NCAA, they focus mostly on rest, although they do acknowledge you should be a little more individualized and consider some of the risk factors. It's pretty much just all about rest. There's a theory behind rest. You know, it gives your body, or your brain rather, sort of time away from stress to use ATP to rebuild the energy stores to get its metabolic self back in order. You saw Mickey talk about all the potassium and calcium and all of that. The reality is that that's true, and we've seen that in animal models. However, the evidence for this in humans is very limited. And in fact, most of it comes from clinics, and most of it comes from patients that have more post-concussive syndrome or symptoms. And both physical and cognitive rest have been looked at, though in only a handful of studies. And what we've seen in those studies, at least in a couple, and this one Mickey and others were involved in, is that when these patients are cognitively active, they do seem to take longer to recover. But again, we're lumping all of these patients together in one, and we're looking at the trends across the group. And that's not necessarily the best way to look at the effectiveness of these treatments as we're learning. So in summary, as the Institute of Medicine in the United States put together, is basically there's limited evidence for something we've been doing for a long time. And when you look to other medical conditions, rest is often the kind of de facto default, and it's not always the best course of action. In fact, many times we learn that it's the wrong course of action. So with that in mind, there's some negatives as well. When you're resting, you have a lot of time to think about your injury. You can have mood changes. You can also have really prolonged physical and cognitive rest, leading to sort of this isolation and withdrawal as well from others, from your sport, from all the things you're used to. Cognitively, if you're not on your phone, if you're not using the computer, I look around today and people are on their phones even during the meeting. Imagine if you can't do that at all for a week. And that's what many times patients are told. So there was a nice study that a colleague of ours at the Medical College of Wisconsin, Danny Thomas, who actually used to work at Pitt as a resident, I believe, or a fellow. He did a great study, a randomized control trial, and he looked at rest. And what he found is if you prescribed prolonged rest, so 5 days compared to 2 days, and then a more progressive return to play, those people that were prescribed longer rest had higher symptoms across all of the days post-injury compared to those that only had a couple of days of rest. These are out of the emergency department, so it was hard to really control the rest so that everyone had exactly the same amount, but these are about averages there. So again, more rest, more symptoms in this case. So we know that it may have these negative effects. We know that some of the effects can be associated with what we call a contextual framing. And in fact, some researchers at Pitt found out that if you just tell someone, go home and rest, what do they think about their injury? Oh, it must be really bad. I can't do anything. And so that contextualizes them to think their injury is much worse, and they report higher symptoms solely because you've told them that. And similarly, people are hypervigilant to their symptoms. And in a particular group we found in a recent study we did, and it's really interesting because this may help explain why females have much higher symptoms than males. This high somatization group, so they basically have symptoms for everything from stomach pain to shoulder pain to whatever. This group has much higher symptoms across the board, and guess who were the most predominant in this group? Females. And so again, that may help to explain some of what we see there. So when we get back to this notion of rest, it seemed like in that first study, rest may be bad if it's prolonged, but we said, well, wait a minute, is it bad for everybody? Is it good for some and maybe bad for others? And this is what we're publishing right now. Can't talk about the journal and stuff because it's in press, but in a nutshell, if you have symptoms only and you get rest, so when you present at the ED, you have this symptom, but you don't really have more overt signs, post-traumatic amnesia, dizziness, etc., that we heard earlier are important, you get worse with rest. So your score goes up if you're told to rest. It actually doesn't get better. In contrast, a group that has a more sort of heavy burden from the injury, there's post-traumatic amnesia, there's dizziness, there's all these overt signs, they're a little bit more significantly injured, they benefited a little bit from rest. So again, it's not as simple as rest good, rest bad. You have to know your patient and you have to know what's going on, both at initial presentation and when they show up in the clinic. So in conclusion, and I know I'm trying to catch up a little time here since we were a little bit over, this injury is very common. In fact, in the U.S., it's the entire country of Ireland that has this injury just from sport each year. So we need to do a better job of separating out what's fact and fiction and kind of countering what we see in the media with good evidence-based information. Hopefully what we presented today shows that, hey, you got to get out, you got to get those athletes out, and maybe now you have some information so you can arm yourself to go with evidence as opposed to just saying, I think that's the best thing. You can say, look, you're going to take 44 days to recover. And then finally, prescribed rest is not as simple as yes or no, good or bad. It may be good initially for some patients. It may not be the best for others. And as you heard from Dr. Collins, earlier activity through vestibular dynamic exertion and things like this may be the course of action necessary to get those patients better faster and in a safer manner. So thank you. I appreciate the time.